Hello everyone, welcome to our awareness health session. Today we have with us Dr. Murali, who is a Ph.D. scholar and experienced occupational therapist and the therapy head at SPANDHAN Life Skill Enhancement Center in Chennai. Sir, please tell us about yourself more.
Hi, Vanakkam. Hi, everyone. Recently, I did my UG from Tamil Nadu Dr. MGR Medical University in Savita College and did my post graduation under Mumbai University in TNMC Medical College, Mumbai, and currently pursuing PhD in Santosh University, Ghaziabad. And I have over 2 decades of clinical experience and 1 decade of teaching experience in the occupational therapy field.
Thank you, sir. Sir, today's our session is going to be on therapy overall. So, Akash, continue.
Hello, sir. How are you
Hi.
now? Sir, actually, we conducted a session for our NGO project. So, we have heard many things about health and awareness about all. We are continuing this session for a long 10 days. But we never heard about the therapy. Sir, can you tell us about what is therapy means in simple words so our audience can just go through on it and understand it?
Okay. See, basically, I understand you're asking about occupational therapy. Basically, what occupational therapy is, by word occupation. So every individual has their own occupations. So helping them to be independent and to be productive in their occupation is what an occupational therapist's job. In simple words, we help the people be independent and productive in society. Let that be a person with disability or person who is working, person has temporary difficulties, or even children or adults. So from birth to till the old age, we cater and we make sure people are able to function in their uh, productive occupational skills. So everyday individual activities like brushing, teething, dressing, and going to a job, performing in a job, or for a child, if you take going to school, playing with children, making friends, like that.
Hmm.
Sir, can you tell me how the operational therapy work, or you can say how you do the occupational therapy to your clients? Because it's many things we heard about that. Somewhere we also heard about psychotherapy, physiotherapy, and counseling. Is that it is same or what, or the different from this physiotherapy or counseling?
Um, See, they are all similar in the factor of working on a person, but the
Okay.
goal or the direction what we work are totally different. Physiotherapist prepare the person physical movements wise. Psychologist address any mental health concerns when it comes to an individual. For an occupational therapist, our job is to make sure the person goes back and does whatever he was doing before. So the preparation of bringing the physical strength to bend and straighten the hand and everything can be done by somebody, but with bending the hand or standing up for a long time or uh, hand movements, how we can do uh, writing work, or how we can do a clerk counting the money or issuing a token, how we can manage money management, time management, and with the perfect amount of abilities or limitations they have, how they can join a job and be a productive member of the society. That's what an occupational therapist does when it comes to adults. And we also go into industries where we do industrial rehabilitation. We assess the industries, manufacturing industries, for health concerns, where because of their workload, if they have any occupational health hazard, like too much of vibration can cause muscle related, bone related problems. Standing on an awkward posture can cause back pain or neck pain. So, ergonomically, how the situation is and how the people have to negotiate those ergonomic difficulties is what occupational therapist does.
Hmm.
So you're running this uh, organization, Suspend. Sir, your organization name SPANDHAN.
Hmm.
Is it right, sir?
Yes, Spandan. Spandan.
Spandhan. Yes, sorry, sir. Sorry for mispronunciation. Spandhan.
Hmm.
Sir, you're running for the more at large 20 for the 20 years.
Yes. Since 2009, I have started 2009 December, and I'm still on.
Sir, can you discuss about some of the example of your patient who can visiting for their occupational therapy if you're comfortable?
Yes, yes. See, I have multidisciplinary team with me when it comes to handling clients, and we also cater all sorts of clients in the Spandan. Majority of the clients, yes, children who are having autism, ADHD, dyslexia, LD, and basically children who have disabilities and who come there. We also have children who are having attention issues and who are not able to perform in the classroom, have handwriting issues, they come to us. We also have children who are cerebral palsy or have congenital anomalies where their head is not controlled or they are not able to stand or sit properly with the help. So we help them achieve their motor milestones and growth milestones in the therapy. When it comes to adults, we have clients who had a stroke, hemiplegia, Parkinson's, Alzheimer's. We have people with dystonia. They all come for the purpose of getting back to their job, or elderly people, they are able to dress or little bit independent in their having their food, all that. So we also do therapy in the therapy center. Also, we go to their house, making sure whatever we achieve in the therapy is attained in the home as well. So making sure they are able to perform their daily activities of daily living in the home. So
Mm,
this is basically the client load. I also get little bit of psychiatric clients for vocational rehabilitation. They come to us only because they are not able to stick to their job for a longer period. They have the history of shifting too many jobs frequently. So they come for occupational therapy related, vocational rehabilitation related, counseling and training.
mm.
Vivek, you want
Sir,
to ask some
yeah.
questions?
Sir, there are
Yeah.
generally some myths around therapy. Like I want to talk to you about that. Like
Mhm.
one of the myth is like therapy works instantly. Like so, how is the process generally? Like time span for general therapy, how is it going to?
No, see, in general, therapy is definitely not going to be a short-term period.
Mm,
Probably for a physiotherapy, yes. In
mm,
certain cases, yes. In certain situations, yes. But not on the whole. It is a long-term process. It takes days. In some people, it takes months and years also. Of course, we try to bring in improvement, bring in balance, everything. And some of the clients, it is only maintenance. If you
mm,
are doing therapy regularly, their functional ability is maintained. They will be able to keep doing their activity within that level. When they stop therapy or when they stop the rehabilitation process, their skill level or their independence level goes down. So
mm,
it definitely is not a short-term process. It takes longer time. Uh, Other than that, it takes therapists who are working in the clinic as well as the family members and caregivers from the home side who can follow up that same exercise or therapy at home as a home
mm,
plan, or regularly in the community.
mm.
I hope
So
that answers.
yes, sir. So there's another myth around is that therapy is generally expensive and unnecessary for general people.
uh, Both are into different. You see, when
Yeah.
money comes to the factor, we
Mm,
all wanted short-term, immediate effect and get out
mm,
of the thing. Even for the allopathic doctor, when we go, so you have to make me stop immediately in a single day. Otherwise, I'll go to a different doctor. But
mm,
even a normal cold takes 7 days, even if you take medicine. The,
mm,
Yes.
the impact may be a little less. But when it comes to therapy, the charges differs.
mm,
I completely understand with different states, different cities, the charges for each therapy is different. But at the same time, there are NGOs, there are private practitioners who are giving therapy in concessional rate or even free for that matter. not for everybody.
Mm.
For the people who are economically low in their lifestyle, definitely they are given preferences, they are given concessions. The government is doing good in almost all the states. There are government hospitals and government therapy centers available. We can take therapy. But only thing concern why the statement comes in, it's a long-term process. When we
Mm.
are not able to take it for a long time, then we say about, it is expensive or anything like that. And I also
Mm.
understand there is a burden on the people when for a year they have to go to therapy and every month they have to pay 10,000 rupees. That means around 1 lakh 20,000 rupees per year. It is a burden on the people. Yes.
Mm.
Uh, Sir, I want to ask that question. I have
Mhm.
I have think about it. Sir, my grandmother is suffering from Parkinson.
Okay.
So, sir, you rarely find this type of cases. The person is suffering from Parkinson. How everyday problem can therapy help with, like normal pain, stress, posture issues, and all? I'm not talking about the Parkinson because it is type of a disease that you cannot in the Zoom meeting.
See, Parkinson's is a disorder where there is this nervous system involved in movement planning and movement control. So there is tremors, there is posture involved. People will lose balance and they will fall because the typical symptom of Parkinsonism is the shortness of gait. They will be in a rush to walk, so they will go and fall in the back. If you
Yes.
slightly nudge them, give a push on the shoulder, they will fall on the sides. Uh, uh, they become rigid, they become tight in one aspect. If you ask them to turn, neck won't turn separately. The whole body will turn. All these things are all symptoms. So, how therapy helps is to loosen the muscles, to maintain that movement control, and to improve balance. These are all the major criteria, major components when it comes to Parkinson's we work on. What happens is when they are little bit free, they wear their dress, they wear their innerwears, they eat their food. But when the tremor starts more, when the stiffness gets more, they don't eat on their own. Then they have to rely on the family member to feed them. They have to rely on the family member to give them food. And because of these symptoms, what happens is somebody has to take care of them completely. Even for that matter, imagine if I have problem in walking and I keep missing my balance and falling down, which usually the case in Parkinson's. What happens is I will not go to the tea shop where I usually go with my friends to have a tea. I will not go to the park where I meet my friends and read a newspaper or just gossiping about random stuff. That will not happen. So I lose
Mm.
out on my friends. I lose out on my social life. I lose out on participating in the community. And I even miss going to my family functions because in a rush place, I will lose balance, I will fall. I don't like people looking at me when my hands are tremoring or I'm not able to eat in the common place. These are all stigma factor also. So I will stop going there. One simple problem of a condition can affect my whole life, restrict me only to the house. That's
Mm.
usually the case in Parkinson's. So when the therapy happens, they are able to postpone that problem for a longer period of time. So it will not get worsened soon. So the therapy delays the progress and maintains it for some time. Then our independence is also maintained. And of course, the family education, the society education, everything comes into the picture. So they are still able to participate in the community activities, be independent in the house with whatever their skills are.
So can you tell me about how normally the occupational therapy help with normal
Not for a person, there is no disability or there is no disease or disorder involved.
Mm.
Um, they come to an occupational therapist either because they have problem working with concentrating on the work, or not able to stay in the work for some time, or like example, if you're an IT professional, you are sitting there in the chair for a longer time. If
Yes.
you maintain a wrong posture in that sitting position, obviously you will end up getting low back pain, you will end up getting neck pain, too much of improper hand use with the keyboard will give you hand pain and wrist pain. Wrist pain might get into something called the carpal tunnel syndrome, which we call it as cumulative trauma disorder. What happens is, because of continuously being in the wrong position, wrong posture, or doing a wrong movement will give you a pain in the body. It can happen anywhere in the body. Mostly it happens in the wrist. So we call it cumulative trauma disorder. So pain in the wrist, carpal tunnel syndrome, in the finger, the muscles get tight and then get stuck in one position. All these things can happen. So for a normal person, it is important to know in occupational therapy that we teach them or we train them in what is the best posture, how to maintain that best posture. One, how to spend your energy wisely and not overdo your posture. So don't expose yourself to any uncomfortable situations. Then relaxation technique, normal stretchings related to posture. So by doing it every now and then in a day, morning or evening, you will avoid your muscles getting tighter. So next day, you can go to the job easily. So when you come back, you remove that stress in the muscle which has caused you for that one particular day.
So generally people feel shy or scared about therapy. So generally, how do you usually break that stigma?
No, if you ask me, have I broken that stigma?
Yeah.
No, not yet. It is still there. Because when they come to occupational therapy, they see people with disabilities, people with neurological conditions. So they like, only people who have mental issues, only people who have neurological issues go to OT. People who go to OT have problems in their life. So automatically, when they go out, they won't tell people that, oh, okay, I went to OT and they helped me do this. Now I'm all right. They don't say this. But when it goes to physio or any other therapy, like, yeah, I had knee pain. Now I'm all right after 4 days. So there is no stigma in the knee pain. But when it comes to a rheumatoid arthritis or something where the deformity is there, they come to occupational therapy because with the deformed hand, you are not able to put on your button, put on your jacket or a blouse. That's when you come to occupational therapy because hand is not able to work. So this becomes a self-image problem. So sharing it is a little difficult task. But nowadays, what happens is the medical practitioners and the community are referring the clients directly for occupational therapy. Immediately they find the need for therapy. So I get stroke clients on the first day also nowadays, which usually not the case. Before and all, it's like they will come only after 2 years or 3 years to me. By that time, my ability to improve them will be very less. But when they come immediately after the stroke, I can work on their hand and bring the hand to near normal function, depending on where the stroke is, where the brain affected.
So many working professionals face neck pain and back pain and physical fatigue due to
Yes.
long sitting hours. Sir, can you just tell me how can they, while working, and they can do some stretching exercise or something or therapy, not a exercise, they can tell that they get rid of this at that moment only.
Yeah. See, let's not even call it as therapy. We
Yes.
go to IT
Exercise
companies.
they can do.
Yes, and we train teachers who are all long-standing or long-sitting position. IT companies, when we go, we do ergonomic risk assessment, where because of what the job you are doing, are you in the risk of getting some health conditions, back pain or neck pain or leg pain, everything. So now, how do we overcome this? Because in the IT job, you are supposed to sit for that 8 hour. There are breaks, of course. Yes, they say it is comfortable. The first thing what you have to do is select a comfortable chair for you and sit properly at the back. Your buttocks and your back has to rest in the chair. Make sure your feet is flat on the floor and your the edge of the chair is touching your back of the knee. All these criteria need to be met. That means ergonomically correct chair, and then comes how much height is the table, how much height is your screen. So when we tell the IT people, your screen has to be in the light, in direct connection with your eye. If that is the correct height, that means you are sitting in a good posture. But what happens is, I can even go back and tell you. See, if somebody sits, we usually like go like this. See, if you are here, we usually like go this way and sit, or stoop so much into the chair, like, or go back and put your head in front and sit. Instead, what happens, like, you push yourself back, sit straight with the shoulders out, you will be in the right position. And when you're okay, so when you're sitting, this is your 90-degree position. So you're can we zoom out? Is my video zoomed in? Did you do it, or it
Yes.
did itself?
Itself, sir.
Okay, I think the camera did it itself. I don't know. I was trying to show if my hands are like 90 degrees, and then I don't have to worry about it. It will rest nicely and well. And use a proper mouse pad, which will be like resting on resting your wrist, so that what happens is what happens is your wrist can rest well. Um, Nowadays, what happens, like, we use it on the lap, on the chest, armrest. So we shouldn't use all that. So give a proper rest. If you're too short, if you feel too short, what you should do is you should use a small block or a little stool under your feet, so that your feet is resting. Don't dangle your feet. So check your ergonomically designed chairs, ergonomically designed system. Nowadays, companies are providing good systems and good chairs. Maintain that height. That's all. Only problem is, wherever we went for ergonomic assessment, in IT companies, the chairs are very less. So people bringing everybody's chair and sitting, and the chairs are mixed for everybody. So sometimes it is a small chair for me, sometimes it is a high chair for me, sometimes it doesn't have one wheel, or no backrest, or broken chair. So this thing the HR department usually takes care. Nowadays, the companies are aware of this, and then they are making sure they need to provide, because the labor law is very stringent nowadays, very strict nowadays. They need to be taking care of their labor. So in that way, yes. How, as an individual, I can overcome it? Every 1 hour once or 40 minutes once, please get up for just 30 seconds or a minute. Stand in a place, stretch little, do the side stretching, bend and touch your toes, slightly go backwards, and just hold your hands and stretch yourself, move your shoulders like this. These are all things which will loosen the muscles which are usually tight around your neck and upper back. Happens in the IT professionals. So if by this you are relaxing, every now and then, if you have a meeting, 10th chair, a friend is sitting or a colleague is sitting, get up from your chair, go talk to them and come. Don't just sit here, do a message in the system itself. No, we will be chatting for the person who is sitting next to us within the chat box. Don't do that. Get up and go and talk. So physical movement is more important. Stretching is more important. And try to maintain a little bit of jogging and walking, physically active work. And then there is also something else, the mental ergonomic fitness. Physically, however, we are supposed to be fit. Mentally also, we are all going through work stress, family stress. Somebody shouted while we are coming to the office. That pressure will come to the office. So do not let that affect you. As a friend, I should make sure if somebody is angry or sad or crying, or I should go and offer my support, that I'm here. Don't get upset. Don't bring that into the office workload. So otherwise, it will build up so much. So helping each other, be supportive of each other is also very important here. And I think nowadays companies have psychologists there to de-stress and share information also. So that's also a good thing.
Sir, generally, nowadays, company majorly there are new companies emerging, like they focus on ergonomics chair, like gaming chair, your neck, what pillow, like. Are they booming right now? Are they in correct way, or they are just doing it lazily? Like, mm, If people were to buy that, are they going to be lazy again, or should they avoid and do physical labor more?
No, it is both. Technology is there, and the assistive devices and devices are there to help us improve
Hmm.
ourselves. But if we rely on them completely, what
Hmm.
happens is our body gives away. So, me having a Ferrari or BMW bike is not important,
Hmm.
but how I should ride that bike is important. If I don't know how to ride that BMW
Hmm.
bike, then what is the point of having a BMW bike?
Hmm.
I can have a normal bike and go. The problem is, the companies can only give you a good chair, good table, and ergonomic settings in your office. Unless until you willingly use it correctly, you will
Hmm.
not be happy with it, or you will not get the benefit out of it. So, the training of the staff on the posture, on the exercises, on short breaks, on being ergonomically safe is very important. So work
Hmm.
simplification, energy conservation, joint protection techniques, stretches, a little bit of relaxation techniques mentally and physically. All these small techniques has to happen every year for the faculties and staff of organizations.
Hmm. So last question for the session, like for youth, what should they do for not going to therapy?
See, there are two things.
Yeah.
Um, One is mentally and one is physically. Always see, physically, try to work out a little. Get up in the morning, go do some workout. Be
Hmm.
aware of your posture. Be aware of not exposing yourself to any hazards in the work. Learn the correct posture and maintain your body in right shape. That
Hmm.
itself will avoid you getting injury. See, if my back is weak, that is when if I drive bike for a longer time, I get back pain. If my back
Hmm.
is strong, if I drive for 1 or 2 hours also, my back will not ache because it will not pain because my back muscles are strong,
Hmm.
right? So you have to keep your muscles strong to avoid getting injury. First thing, prepare.
Hmm.
Avoid getting injury is very important. So safety is very important. Once it has happened, most of the time what happens is we take it lightly.
Hmm.
Uh, it's like, yeah, everybody gets shoulder pain, everybody
Hmm.
gets a headache. So if I sleep for half an hour, it will be all right. If I take one sip of coffee, it will be all right. No, not
Hmm.
every time. If you get headache every day when you leave your office, that means something in the office is giving you headache.
Hmm.
Try to remove what is giving you headache. So find out what is the reason why you are getting that small symptoms. Your body will give you symptoms that you are not all right, like slight niggle
Hmm.
while you're walking, slight back pain. So initially when you are going home, if you sleep half an hour, your pain will go. Next day, if
Hmm.
you next month, if you sleep for 1 hour, it will go. 6 months later, if you sleep the whole night, your pain will go. But one
Hmm.
year later, even if you sleep the whole night, your pain will not go. Because that whole 1 year, we have ignored the symptoms the body was giving us that I'm getting
Hmm.
hurt, which is very important. These are all for the regular persons to come. But if there is any neurological condition or any accidents involved, consult with the physician or the proper medical professional, then get
Hmm.
into therapy. Maybe not everybody needs occupational therapy in that matter. Some
Hmm.
people may need it, but when you need it, approach the right kind of person. When I say
Hmm.
right kind of person, there are lots of. This is India. This is India,
Hmm.
so there are lots of quacks, we would call, or fake occupational therapists we would call. So be
Hmm.
aware. This is in every field. Everywhere there is somebody who's saying, "No, I can cure it. I can say this thing. I can say that thing." But
Hmm.
make sure you go to the right professional, and you have all the rights to ask what's their qualification. Are they really qualified people? Then take the help from them.
Hmm. Thank you, sir.
Sir,
Thank you for
before
the
we conclude
session.
Vivek, one
Sorry.
minute.
Yes. Yes, Akash.
Sir, before we conclude the meeting, Sir, can you tell about your organization Spandan and where, how can
Yeah.
people reach out to you and how they can talk to you and about all these problems, sir?
Okay, see, if anybody who has an issue related or who will need a help in occupational therapy, you can reach out to Spandan Rehabilitation and Therapy Services. You can Google it, you will get it. Initially, it was known as Spandan Life Skills Enhancement Center.
Mm.
We are in Chennai. We are in two places in Chennai. One is in Annanagar, one is in Kolattur. Um, Spandan Rehab at gmail.com is the email ID. SPANDHAN REHAB at gmail.com is the email ID. You can always reach out. My official number for the contact is 9345 333 960. 9345 333 960 is the Spandan number. You can call up. Usually, I will pick up or my staff will pick up. They'll fix an appointment to consult with me.
Okay, sir. Thank you. Thank you for your wonderful time. Hope you enjoyed it.
Thank you,
Thank you,
Akash.
sir.
Thank you, Vivek. This is very important to spread awareness about each profession, and people in need will get the understanding and awareness about what are all available for them.
Mm.
Thank
Thank
you.
you, sir.